Welcome back to the Burnout Recovery Podcast. My name is Dr. Jo Braid, and I am your host for this episode of the Burnout Recovery Podcast. Yesterday, I gave a local presentation here to a room full of urologists, and I presented the wellbeing talk that they had in their 3-day conference and absolutely loved it. It was very punchy. I had to stick to time, which I did. And I talked all about protecting the asset, as in themselves, and gave them some practical mindset strategies to use, including the gap and the gain. So I've talked around the arrival fallacy before. This is the same concept. And also finding out what is meaningful for you in your workplace and thinking about what is and is not in your control. So love giving those short, punchy talks that don't carry on for too long in a way, so that there's short takeaways people can have. Stay tuned on the podcast for 12 hacks for Christmas. I am prepping these up for you guys, and they will be releasing at the start of December. So there'll be a podcast in relation to this and a bit of extra stuff on social media. Before I get into this week's podcast episode, I would like to acknowledge the traditional owners of the land and the waterways of Orange, which I live on with my family and love and enjoy. This is where this podcast is recorded, and I pay my respect to elders past and present of the Wiradjuri Nation. So today I want to navigate this topic around exploring identities beyond the white coat. Now, it is not only doctors who I coach a whole range of clinicians and also small business owners. However, the majority of my clients are doctors, and we don't wear white coats anymore. I think that still happens in some parts of the United States, but it's been many, many, many years since I had a white coat around my shoulders. I want to see if this can be relatable to you. You know, I'm in a fairly small town here in Orange of about 40,000 people. It's easy to meet people on the street, to bump into people in different shops or at different venues around town. And there could be a scenario where you have that identity as a healthcare professional, and when other people see you, they see you as a healthcare professional. They don't see you in the other identities that you might have in your life, like a parent, like a spouse, like a sister, like a daughter, etc. And so they communicate with you as in that one identity that they know you from before, as a doctor or as a healthcare professional. And in this episode, I really want to invite you to explore and grow your awareness around different identities that you have in yourself. And I've got a really awesome foundational tool that I use a lot in my coaching practices, so you can recognize and manage your thoughts and feelings in each identity you have. So we work hard to grow our clinical expertise. We go through lots of exams. We go through hours of training to become the clinician or the professional who we are in our role in the workplace. And many healthcare professionals naturally identify very closely with their role, but often to the point of overshadowing other parts of themselves. And really, you are not your role. And so, who are you? Here's some examples of other identities you might hold: a parent, a spouse, a friend, a community member, an athlete, an artist, for example. And so in this podcast, have a think around those other identities that maybe haven't been getting much light recently, if you know what I mean. Work may have been very all-consuming. You might have an on-call aspect to your role as well. And, you know, they might be a bit overshadowed, as I've said, some of those other identities that you have too. And so when you think about the other identities you hold outside of work, which ones bring you, for example, joy or another kind of fulfillment, or make you feel really peaceful? The challenge with taking off the white coat is sort of, when does that white coat come off? And a while back, I had that concept of having a cupboard, or a wardrobe, I should say, where you have your different outfits that you wear when you're in your different identities. And I think that's where the white coat identity can fit quite neatly. It's time to take out my white coat and put it on, and I am showing up as a doctor today, with the feelings that I have when I am being a doctor and the actions that I take. And that reinforces that identity of me being a doctor in that daytime role. When does that white coat come off? When do you put it away? What is that transition moment when you finish your work and take off your scrubs, for example, and change and become the parent or the spouse or whatever you're transitioning to after you've been in your workplace? And it can be really hard to step away from one's doctor identity, for example, in public or in small communities. You might be having a beverage with friends or family at the local pub, and somebody bowls up to you and shows you a bit of skin and says, "Hey doc, can you have a look at this, please?" And so this is a challenge that others may well have as well, people in caregiving or public-facing professions, such as teachers or maybe lawyers and accountants and so forth. So we've got this concept that we can have our range of identities, but to other people, they may also see us in that role that they know us. And what I want to share with you now is the foundational tool that I use with clients called the model, which was derived from cognitive behavioral therapy by Brooke Castillo. That's who I did my coach training with, my original coach training. And the model is a really useful tool that helps you examine how your thoughts about a certain scenario or circumstance create your feelings, which in turn affect your behavior and the outcomes you have or the results you get. So here are the 5 components of the model. We have the circumstance. This is a very neutral fact, okay? 2 people in a court of law would agree on it. So we're going to do the example of, I am a doctor. And then when you become aware of the thought, what you think about this fact, an example could be, I should always be ready to help. How does that make you feel? So you've gone from the circumstance to the thought to the feeling. So one single feeling, you might feel responsible. And, you know, this thought might carry on outside of the workplace as well. I must be feeling responsible, or I feel responsible even in non-work settings. Then you look at your actions or your behaviors. What do you do as a result of this feeling? Well, you check for messages related to work. You answer medical questions off the clock. You respond to a patient conversation outside of the workplace. Those could be, you don't say, no, I can't look at that now. You'll have to book in and see me next week. You stay responsible in your role with that identity of being a doctor 24/7. And what's the outcome of that? What's the result you get? You get that result that you are more likely to be always on duty. I'm never stepping away from this role. It's always on. So you can see that that thought that you have around that neutral fact of I should always be ready to help creates that outcome that you have, feeling like you're always on duty. So I've got some more examples of using the model for identity work, and I've got 2 more examples that might resonate with you. So let's get around the concept of running late. That is something that comes up with my clients, and I coach them around time management and what is behind this pattern you get through your day of always being late for appointments. So the circumstance would be like clear, neutral facts. I have 3 minutes to get to my next appointment. So it is scheduled at 11 and it is now 10:57, for example. So that's very neutral, very clear. And your thought is, I'm always running late. And so maybe the journey time is longer than 3 minutes and, you're like, oh, I'm running late again. I never manage my time well. How do you feel from that thought? I never manage my time well. You might feel anxious. You might feel stressed. You might be self-critical. That comes up a lot. And what actions do you take from feeling stressed? You're rushing. You skip your break that you had scheduled during the day. You become scattered. You become flustered. You become distracted. You lose your focus. And the result is you arrive late, confirming that thought of, I never manage my time well. And you arrive after the scheduled appointment time. You're more likely to make that happen. Now, I want to support you with that awareness around when you think I'm always late or I never manage my time well, you're more likely to validate that thought in your life, in your results that you create and the outcomes you have. I want to support you with how you could think differently around having 3 minutes until your appointment time. You could be thinking things like, I'm doing the best I can with the time I have. And that could change how you feel. So you might feel more calm or more accepting of the situation, and you're more composed. You're not so flustered and scattered. And, you might still arrive late, or you might still not get to the appointment exactly on time. However, how you feel about it is different to the earlier example that I gave. And really, our feelings drive our actions. Our feelings drive why we do what we do. And I hope that this is an example of how you could change around how you're feeling and how your approach is to getting to your appointments on time. And I bet that if you are starting to feel more accepting and calm around getting to appointments, or maybe opening your clinic door to your next patient closer to the scheduled time, that will impact on your engagement with that patient and how they leave the appointment and what healthcare recommendations they take on, potentially how you present yourself. So, there could be a real longer term impact by managing your mind, by looking at the thoughts you have when you're in your schedule, in your day-to-day work. I've got another model that I wanted to share, which really ties in with the work that I do here as a coach and also what I share on my podcast. Let's see what happens if you have an identity as I'm burnt out. Okay, so let's see how that could affect you on your day-to-day life. Imagine your circumstance is you have patient appointments that are back-to-back all week. So that can just about be neutral. I have appointments with no gaps all week. Okay, so everything's tight and there's no white space, I guess, in your schedule, which I have referred to in an earlier podcast episode. Your thought is, I'm burnt out. I can't keep doing this. Your feeling is, I'm exhausted. I'm trapped. I'm unmotivated. Your actions are, you go through the motions, you avoid social interactions, and you struggle to engage with work. So this is exactly what happens in a burnout scenario. Somebody becomes somewhat distant from people around them. They reduce their productivity. They're feeling quite cynical or depersonalized in the workplace. And the result would be they have reduced job satisfaction, and they are more likely to keep thinking, I can't keep doing this. So you can see how growing this awareness of our thoughts about a situation and feelings and actions influences the results that we have in our life. And I would invite you to think around this concept of having back-to-back patient appointments all week. A different way you could think about that is, I'm focusing on one task at a time, and you might then be feeling more capable, more grounded, more focused. And your actions would be different, and your results are you're more likely to get through one task at a time. And I would say that's a great burnout recovery strategy, because you are then seeing the progress you are making. It can feel like you're floundering or drowning and just not making any progress at all when you're in the depths of burnout. But with this different approach, you're looking at one task at a time. You're helping that brain that is easily distracted get to focus on one task at a time. Let's complete this, and then I'll make sure I know what the next one is to do as well. So what I've done here today is we've moved from talking a bit about identity work to introducing the model, which is a foundational tool that I use in coaching very often with clients. And this really helps my clients become independent in their self-coaching as well. Hey, look, I really see the benefit of having a regular coach for the long term, and that is something that I choose to invest in. And I use self-coaching tools in between my coaching sessions. And I really wanted to share with you some tools that you can use, even if you haven't started having a coaching session yet. So have a bit of a think, reflecting on the different identities you have outside of being a doctor. It can be great to journal around this. Write down your thoughts. What do you notice yourself thinking? And how do you feel with each thought? It can be great to set a boundary or have a mental cue, like removing your badge or mentally signing off, to help you transition out of work. So it can be a small routine you do to metaphorically take off your white coat or remove your scrubs, whatever relates to how you see yourself in your professional role. And then reflect on the model to examine your thoughts and feelings in your various identities. So as I wrap up this podcast episode, I invite you to acknowledge and nurture all the aspects of yourself that you have, all the different identities you have, and that can lead a more fulfilling life for you. If you want more resources around this, please head to my website, where I have a whole range of resources that tie in with the model and other tools that I use for coaching with regards to the model. And if you're interested in further exploring your identity work or getting confident in using the model and other coaching tools, please sign up for a discovery call with me. This is where we meet each other and get a chance to hear what's been going on for you and where you'd like to get to. And I will share at least 3 strategies that you could use to get yourself there. And if it seems like a good fit, invite you to engage with me in a coaching program. 2025 could be a different year for you, with the support of a coach like me or somebody else to get you out of burnout and stay out of burnout as well. Have a sense of that energy coming back and being there for you on the daily, as well as fulfillment and, more satisfaction in what you do. I hope today has been a good podcast episode for you, with a practical tool and some invitation for reflection around the different identities you have in your life. Have a great week. Thank you.